Meanings bring values. When we understand the meanings, we will remember it longer. Anatomical terminologies are all described in Greek and Latin. When we understand the meanings of these Greek and Latin terminologies, the memory will be better to recall the structures. Let us look at some regions. The pectoral means breast region or chest region. The brachium is arm. Antebrachium is opposite to the arm when it is flexed. The cubit is elbow. The carpus is wrist. The thenar is I strike first. Whenever we strike any object, the part of the hand which strikes first is the thenar eminence. Then hypothenar I strike next. The pollex, the meaning is thumb. The index finger. The digiti minimi. The veins, we name them cephalic vein and basilic vein. They are with respect to their positions in the body in anatomical position. Cephalic vein is on the head side, cephalic side, basilic vein is on the basal side. Muscles are named with respect to their size, shape, the heads they take origin, location and action. Let us look at few. The muscle present in the arm having two heads, biceps brachii. The muscle present in the arm back, three heads, triceps brachii. Pectoralis major and minor. Coracoid process is crow beak-like process of the scapula. Between the coracoid process to arm, coracobrachialis. Above the spine of the scapula, supraspinatus. Below the spine, infraspinatus. The meaning of acromion is highest summit of the shoulder. On the costal surface, subscapularis, muscle below the scapula. A triangular muscle, delta. The meaning of delta is triangle, deltoid. Left side, the complete trapezius is shown. The shape of the muscle is in the form of trapezium. The muscle which elevates the scapula, levator scapulae. The muscle which are rhomboid in shape, rhomboids major and rhomboids minor. The muscle on the lateral side of the dorsum, latissimus dorsi. The muscle having the serrated edges and anteriorly located, serratus anterior. The meaning of teres is round. Teres major, the round major, and teres minor. The muscle which pronates and round in shape, pronator teres. The muscle pronates which is quadrangular in shape, pronator quadratus. The muscle which flexes the wrist from the radial side is flexor carpi radialis. The muscle which flexes the wrist from the ulnar side, flexor carpi ulnaris. The muscle which is long and blends with the aponeurosis of the palm, palmaris longus. The muscle which is in the superficial plane is superficialis. The muscle which flexes the digits and superficial, flexor digitorum superficialis. The muscle which is deep, flexor digitorum profundus. The muscle which flexes the pollex, flexor pollicis longus. If there is longus, there should be a brevis. Brevis is small. Flexor pollicis brevis will be muscle in the thenar group. Anconeus, which anchors the upper end of radius and ulna together during pronation and supination, preventing them from separation. Brachioradialis tells the attachment from brachium to radius. In the same way, extensor muscles, extensor digitorum, extensor digiti minimi, extensor indicis. Between radius and ulna, we find a membrane that is in between the bones, that is interosseous membrane. The vessels and nerves in front are anterior interosseous nerves and vessels. Just like that, we have posterior interosseous nerves and vessels. In the hand also we have interosseous muscles which are palmar side and dorsal side. Jantuvulu, roundworm, is also known as Ascaris lumbricoids. The meaning of lumbrical is worm-like. These are worm-like muscles taking origin from the tendon of flexor digitorum profundus. By knowing the meaning, we remember the things longer.